Your definition of high intensity interval training. What heart rate percent for how long and then repeated for how often?
For the latest in health-related information and ways to save your life, check out the newsletter.
That's a really good point. That's like saying, what's your definition of effective exercise? If you're somebody whose biggest form of exercise right now is walking in the mall, I don't recommend that you get to a heart rate of 135. Most 65-year-old, I would say, you're going to hear me use absolute numbers and ages, and you're going to say, Ford, that doesn't really work. I want a percentage, and percentages are based on ages, right? But the point I'm going to make here is that breaks down as well. I'm 65 years old, and like a lot of my patients, I routinely get significantly over 160 or so in terms of my high intensity interval heart rates. Now, that's not appropriate for most 65-year-olds. It's more appropriate to hit into the 130s. I don't think I can get any plainer or simpler than that. If you've done nothing but walking in the mall for the past decade, that's been your biggest source of exercise, I don't suggest you go out and try to do 10 intervals of getting your heart rate even to 130. So high intensity interval, your ceiling depends on where your floor is. Now, a couple of other things to acknowledge about this. What's the purpose for high intensity intervals? Well, what does it actually accomplish? Let's talk about that for a second. High intensity intervals actually deals with maybe the biggest issue with aging and insulin resistance. One of the things that we say with insulin resistance and the perception that we all tend to have is, like most things, a little bit too simplistic. We tend to think, well, there's these insulin receptors in the cell wall, and they pull sugar out of the blood where high levels cause damage and pull them into the muscle or liver cell where they don't cause damage. So it's all about the function of those insulin receptors. Well, let's go back and look at a little bit more microanatomy. What do I mean by that? Well, microvasculature. What do I mean by that? Capillaries. What is the capillary richness of your muscles? So as we age, especially getting past 65, you start losing a lot of that capillary mass within your muscle tissue. If you lose capillary mass, then you're basically losing the interaction space, the surface area that the insulin receptors that are in the muscle cell wall can use to pull that sugar out of the blood. In other words, maybe this is really more of an issue of surface area of capillary to muscle tissue. You see why I'm going in that direction when I start talking about high intensity intervals? That's exactly what high intensity interval work does. Now, how can you get high intensity intervals? Well, you can get them working on machines, going from one to the next to the next. What kind of timing do you want to do? Marathoners talk about a 5-minute intense of a interval. Well, yeah, that's true if you're a marathoner, but really, when you're talking about prevention and health, disease prevention, and you're talking about pushing increased capillary growth to the muscle tissue, you really should talk about a minute or at most 2 minutes in the intense phase, followed by about that same phase of very slowing down. And what's the purpose of slowing down? Slowing down is so you can recuperate, so you can charge back into that intense phase. Now, what is an intense phase? What percentage of your absolute max? We've already covered that. I'm not going to cover that again. But here's one thing I would say. You do want to get to where you're doing that. People say when you're exercising, you want to do aerobics. You want to be able to sing or hum to yourself or talk to a friend. Well, that's light aerobics. That is not high intensity interval phase. You need to be for about a minute where you're doing that. And yeah, it's going to be, if you're a mall walker, you're not quite ready for that. But that's the long-term goal. Slowly build up, a personal record today, another personal record in a couple of weeks, another personal record. Get to where you can do that. Another question about high intensity interval training. Which ones do you want to do that for? You work out on a machine and get it in your muscles? You want it in your muscles, but let's think about muscle size and mass. I'm no Arnold Schwarzenegger. Even if I were, his arms are not his major muscle mass. His legs are his major muscle mass. So what I recommend is that you look for ways to create this intensity of working out using primarily leg muscles. So you got me started. As you can tell, I'm a really big fan of high intensity interval training. Now, a couple of other things about HIIT training. Start with 3 intervals per session. You can work up to 10. Don't go beyond 10 intervals in a session. And go at usually 2, at most 3 sessions per week. I have people come to me and say, no, I'm doing them every day. Well, you're not really doing enough intensity if you're doing them every day and able to survive. You need to be pushing it. So if you're doing them more than 3 times a week, back off to 3 times a week or twice a week, but ramp up the intensity, because that's what you need to be doing. That is what improves the microvasculature, the capillary density of your muscle tissue to improve your insulin response.